Good morning, everyone. Today we discuss about the role of psychiatric, social worker, in community mental health. The first we discuss about the key function of psychiatric social worker, direct client service. First one. Then it is cases management, crisis intervention, advocacy. Direct client services means that they provide assessment, therapy, and counseling, which is all services provided by the social worker to the client, which is assessment, therapies, counseling, as the need of the client or the situation faced by the client or the problem of the client. The therapies are given and the counselings are given to the clients. Cases management. As a case taken, the several sections are there in the cases. All the sections are managed by the case social worker. The intake, assessment, diagnosis, intervention, goal setting, evaluation, termination, follow-up of the client. All these are included in the cases management. All these is according to the each cases, the services, each client is having different therapies or different services are given to them. The client is directed by the social worker to such services and get referred to them and guided them to get those services and get benefit in their life. Crisis intervention, the response to acute mental health emergency. When a mental health emergency occur, how it is the social worker deal with the situations and manages the situations and provide the whatever needed to manage those situations and make them. If a community is facing such a calamities or a disaster is facing, the community is guided, providing them supported by the social worker. Advocacy, social worker stand for the need and rights of the client. Whatever the right is, whatever the rights of the clients are there, all the rights are provided to the client. Psychiatric social worker in community settings. First, it is about a community center. Community center where all services are provided at the community center. Psychiatric social worker services, and counseling services, awareness programs. All the services are provided at the community center. School, the social worker work for the children's or students' mental health. All the programs to enhance the students' mental health, to promote awareness among the administrative about the students' mental health, how to enhance this, how to improve their academic performance. All these functions are at the school. Hospitals, so the social worker guide them in their admissions towards the discharges, guide them in accordance to the needed to need according to the problems or the health issues to the consult doctors, and provide them the resources available in the hospitals, and also help them the financial, and also provide the counselings to the family members about the patients or client situations and how to handle it and how to provide the care to them. The homeless shelters, this is supporting to the individuals who is having homeless in the community through the collaborating teams in the community who is providing shelter care programs for the homeless peoples. Next, skills and competencies recorded. First, clinical assessment diagnosis skill. It is a must skill required for the social worker to diagnosis and for the cases clinical assessment of the psychotic problems. Then knowledge of psychopharmacology, which means about the medicine given to the psychotic patients for the illness to reduce the symptoms and to make them normal life. Then cultural competence and sensitivity as working in a community area. The social worker should be aware about the cultural, their norms, values, the rituals, all the should be aware, and should be handled with very care. Challenges faced by psychiatric social worker: how high caseloads, As the cases increases, should the resource also need to be provided, and without that the services cannot be provided as benefit essential to the beneficiaries. Then burnout, as working in a stressful conditions, it will be lead to burnout in the social workers or service provider. It will affect their health, mental health also. Stigma, mental health carries a stigma in the community. How it is dealt, and it should be dealt in a neat way. It should be aware, make the community aware about the mental illness, how to be handled, how to be, how this treatment goes on, why the people are behaving in such a way. All these are a huge barrier in front of the psychiatric social worker. So the stigma should be removed from the community. Ethical dilemmas, they faces ethical dilemmas in mandated reporting situations. When there's a reporting situations in the uh, occur in the psychiatric social worker, it should be the psychiatric social worker should be performing according to the situations. The ethical value should be is breaking down the dilemma will be occur. Next, it is we discuss about overcoming the challenges, studies and situations. Self-care. A self-care is needed because when we are stressed out, we'll be burnout and it will lead to many problems. So self-care plan should be needed. Advocacy for more increasing fund the policy or the services, fund should be provided for these services by the authorized people. Collaborations with other community peoples or community agencies, NGOs, uh, or the group of people who are providing the such services in the community. With the collaboration with them, we could do more services in the community, establish the services in the community, and make them reachable to the people. Public awareness, make the public aware about the services provided, and to establish and to make them use beneficially, and get what are the services available in the community by the government. The future of psychiatric social worker. First, it's about growing demand. The demand of psychiatric social worker is in huge rises. People are aware about the mental health. Then technology, the telepathy, telehealth is needed, which means that um, counseling services provided to the telephones or through the calls. The counseling services are provided to support the people at the time of their need, such as when there is an exams or when there is natural calamities. The counseling services are available. Then prevention, early intervention is emphasized. Early identification of any psychological problem will be helpful to um, reduce the symptoms and bring the patients to a normal balanced life. Advocacy, social worker advocates for the policy. The policies are formulating for the making the social worker as a high valued position in the community, to stand for the values of the social worker, and to the need of mental health in the community. So that's all about the psychiatric social worker, the role of and the community mental health. Thank you.